Next question comes from Barb Ambergy, and Barb writes, my main objection is the debt incurred to provide this program. This country cannot keep spending money it doesn't have and pushing for more and more debt onto future generations. Well, Barb, I agree with you. And, you know, let's face it, the healthcare system was not perfect before this legislation was written, so I'm not saying there shouldn't have been any changes. But even if we had come up with a proposal that really made sense in terms of our healthcare system, and I would argue this one didn't, we can talk about that later maybe, but we can't afford it. The Congressional Budget Office, which is a nonpartisan group here in the Congress, you know, they're not Democrat, they're not Republican, they just analyze stuff. They estimate that federal spending and subsidies for health care alone is going to grow by $390 billion over the next 10 years because of this new health care law. And that's in addition to the 2013 budget the President just submitted, which would increase the nation's debt by another $11 trillion over the next 10 years. So we're talking about significant new costs connected with this health care law. Recently, you know, the same Congressional Budget Office said it's not going to be $1 trillion, it's going to be 1.1 trillion, in other words, another 100 billion. So the costs are going up, not down. You'll recall that when President Obama was elected, he promised to cut the deficit in half. Unfortunately, we're seeing another deficit this year of over $1 trillion, $1.2, $1.3 trillion. So we've got to do something on this debt and deficit. I agree with you, Barb. And again, our healthcare system needs to be fixed, no question about it. But we simply cannot afford this healthcare bill because it's on top of so much other debt we've piled onto our kids and our grandkids.